According to a 2017 article published in the Asian Journal of Pharmaceutical Sciences, serrapeptidase is a leading enzyme which has a very long history of medical use as an effective anti-inflammatory drug. Starting in the 50s, proteolytic enzymes in the same family as serrapeptase began being used as natural pain-killing agents. They were primarily prescribed to relieve pain and inflammation associated with common conditions like rheumatoid arthritis, ulcerative colitis, injuries, surgery, wounds, and viral pneumonia. In the 80s and the 90s, when Japanese and European researchers compared several enzymes for potential anti-inflammatory activity, they found that serrapeptase, also called serrapeptidase, was the most effective at controlling the body's inflammatory response. A major advantage of treating pain with serrapeptase rather than over-the-counter drugs, such as non-steroidal anti-inflammatory drugs, is that it causes few side effects in most people. Serrapeptase is a proteolytic enzyme in the trypsin family. Another name for it is serrapeptidase. Like other proteolytic enzymes, the serrapeptase helps to break down proteins into small molecules. It can promote healing by reducing fluid and debris accumulation that can occur around tissues when an injury takes place. Today, serrapeptase is mostly isolated from a non-pathogenic bacteria called Serratia E115, which is found in silkworms. While it can help to reduce discomfort, serrapeptase works differently than many other anti-inflammatory pain-killing drugs. Researchers believe that enzymes like serrapeptase work to reduce inflammation by facilitating immune cell movement and regulating levels of lymphocytes at the site of inflammation. It's been shown to help curb inflammation thus associated with arthritis, neurological disorders, heart disease, injuries including wounds and sprains, sinusitis and bronchitis, fibrocystic breast tissue, carpal tunnel syndrome, muscle inflammation, and many other conditions. Inflammation is the body's natural response to injury, autoimmune conditions, or infection. It's also a key component of many physiological conditions that can cause pain. Enzyme-based anti-inflammatory drugs are becoming preferred over conventional chemical-based drugs that reduce pain because they generally have limited side effects. In countries including Japan and many in Europe, serrapeptase is currently considered the anti-inflammatory and pain treatment of choice. Non-steroidal anti-inflammatory drugs are most widely used painkillers in the world. They're often used with other medications, such as steroidal drugs, to treat conditions like autoimmune disorders. The non-steroidal anti-inflammatory drugs work by blocking the production of inflammatory mediators. While these drugs can provide symptomatic relief, they don't work to actually cure underlying causes of diseases or ailments, and they can lead to digestive, liver, and renal-related problems when used long-term. Serrapeptidase is effective at regulating immune cell migration from lymph nodes to inflamed and injured tissues. Both of those are beneficial for bringing back tissues to normal and maintaining homeostasis. This enzyme seems to work in part by breaking down cyclooxygenase. Cyclooxygenase is an enzyme that's responsible for producing different inflammatory molecules. It can also reduce pain by blocking the release of bradykinin in damaged tissues, which leads to a pain response. Certain studies show that serrapeptase has potential to help lower atherosclerosis and heart disease. Serrapeptase has fibrinolytic properties. This means that it can help stop blood clots from forming. One way it does this is by breaking down the blood clotting molecule called fibrin, because it can help remove deposits, such as those formed by excess calcium, plus fight inflammation, serrapeptase may also be useful in preventing strokes. Thanks to its casinolytic properties, serrapeptase can help control harmful bacteria and prevent infections. Serrapeptase has been shown to support wound healing and wound cleaning. This enzyme has also been shown to repair burns and trauma to the skin. It's useful for promoting recovery from infections and injuries because it's been shown to decrease swelling, reduce formation of scar tissue, reduce excess mucus, break down excess proteins, decrease the permeability of capillaries, control histamine responses, control skin temperature, and facilitate the absorption of decomposed products through the blood and the lymph system. Additionally, serrapeptidase has been found to enhance the activity of several antibiotics that have widespread use in treating infections, like ampicillin and cycloxilin. Serrapeptase is used in combination with other drugs to manage infections like sinusitis and bronchitis. This is mostly due to its ability to thin and mobilize excess mucus and fluids from the body. It also supports lymphatic drainage and controls inflammatory responses. Certain studies have found that serrapeptase can reduce accumulation of neutrophils. Neutrophils are white blood cells released from the immune system in response to an infection. Excessive accumulation of neutrophils in the lungs can thicken mucus and worsen symptoms affecting the ear, nose, and the throat. Several findings suggest that serrapeptase and similar enzymes can be effective alone or in combination with other drugs used to treat autoimmune diseases, like rheumatoid arthritis. It's still not entirely clear how the serrapeptase works to fight autoimmune responses. However, it's believed that the enzyme possesses the unique ability to dissolve dead and damaged tissue, created as a byproduct of the body's healing response, without harming living tissues. Recent study results suggest that the oral administration of proteolytic enzymes, including serrapeptase and nattokinase, may be effective in modulating certain factors that characterize Alzheimer's disease. Researchers believe that enzymes may have a therapeutic application in the treatment of neurological disorders because they can lead to a significant decrease in brain-derived neutropic factor and insulin-like growth factor 1 when compared with controls. One study found that supplementation with these enzymes caused significant declines in the expression levels of certain genes linked to Alzheimer's in the brain. In animal studies, these enzymes have been shown to have positive effects on brain tissue and neurological degradation in the hippocampus and the focus hyalinosis. Serrapeptase is combined with broad-spectrum antibiotics in the treatment of osteoarticular infection. This is a type of infection that affects the bones and the joints. It can occur in both children and adults. Certain studies have also found that serrapeptase can help to significantly reduce swelling following injuries and operations. In fact, one study found that it reduced swelling by up to 50% after 3 days of treatment. It's used in the treatment of conditions that are triggered, at least in part, by inflammation. These include carpal tunnel syndrome, sprains, torn ligaments, and post-operative inflammation and swelling. Research to date shows that serrapeptase is generally well tolerated by adults. Possible serrapeptase side effects may include digestive upset, including nausea, skin inflammation, and spreading of a rash, muscle aches and joint pain, an increased risk for pneumonia, potentially an increased risk for infections such as a bladder infection, and potentially an increased risk of bleeding and bruising, especially when combined with drugs such as warfarin or aspirin. Since 1997, Serrapeptase has been sold as a dietary supplement and used in medical interventions by doctors in a number of settings. There's various ways that Serrapeptase can now be administered. These include as a gel, an ointment, a capsule, and in some cases, intravenous injections. Serrapeptase dosage depends on the condition being treated, as well as the patient's medical history, body size and age, etc. In most studies, serrapeptase is used in adults at doses that range from about 10 to 60 milligrams per day, most often between 15 to 30 milligrams per day, in order to be effective. However, smaller doses of about 5 milligrams may also be helpful for reducing mild discomfort. It's best to take serrapeptase on an empty stomach, usually first thing in the morning or between meals after eating. Ideally wait 2 hours before taking serrapeptase.